do you feel like for yourself, or do you know someone who is struggling with anxiety, maybe some inner emotional trauma, and they feel like they don't really have anyone to reach out to, talk to? This happens all the time in our school systems, and this just goes to show how much and why so much mental health is needed when it comes to having those mental health resources. You may even know someone, maybe who's not yourself, who you can look at and you could say that they've had some issues and they needed some help, and they may have not have had that help available to them, or vice versa, someone who's had some internal issues that they've needed to get resolved, and they've needed to reach out for some help. And maybe they were able to go see a therapist, go see somebody, and maybe good for them that they had the chance to. But on a day-to-day, many people do not have a person to reach out to, especially in our school systems. And we're going to get into that now, on why there's such a big need for the expansion of the mental health services when it comes to the school systems. And then also have some visual aids here to kind of go over and kind of show and convey why that's needed. So we can get started with our first visual aid here. We can see it's going to be a backpack. Now what this backpack is really going to symbolize, it's really going to symbolize the burden that kids feel when it comes to stress, anxieties, and a lot of their emotional traumas. So 1 in 5 kids in the school system are going through something emotionally, and whether that's anxiety, stress, and they have no one to talk to. That's not really a good statistic, as that shows that many kids need help, and many kids need that person to reach out to, because they may not have that support system at home. They may not have that support system anywhere, and the schools are where they're going to need it the most. For one, schools should not just be a place where the kids are learning and understanding different things. They should also be a place where the kids can go to even understand themselves. Maybe have someone kind of dissect their brain a little bit, maybe in a different way that they're not used to, because at home they may not be the most talkative. They may just be in their room all day, or they may not have that sibling or that adult that they can really talk to and confide in, because that adult may be busy, or you don't really know what circumstance that person is going through. When we also move on, we can look at the impact that it's had when it comes to mental health on the kids to this day. Is you can look at it sometimes when it comes to the stress nowadays, when we have bullying and everything's online. It's hard for someone to really communicate sometimes when they're online. And I know many people go after the bullying and they try to tackle bullying, but we should also tackle the mental health and mental abuse and trauma that comes with that. And I don't feel like we have that enough in the school systems to this day to really tackle and show how severe it is for a kid's trauma. And there's many different associations that try to come through and try to combat that. When we start off with the first one, the National Institute of Mental Health, which they provided tons of information on this topic here for me. They try to do different things with funding and changing the school systems, and trying to really show that there is another way for students to get that help. Also, the Association of Psychiatrists in America, that's another great resource that I use, and they also try to bring more psychiatrists and therapists to schools, and not just that counselor help, but more professional help that's really needed. And that lets us move on to our next topic of the funding that's needed to really get those professionals into that school system. With that, we're going to use here our next thing, which is kind of like a donation jar, which kind of symbolizes the donation and funding that we do need as a school system. So when we start off, first off, trained professionals. Obviously many trained professionals are really what we need in the school system, as the trained professionals are going to be the ones who are going to really be there. Like I said, a counselor or a teacher, they can only do so much. Their job is to teach. Their job is not to sit down and really understand a student's mental health. And I feel like many places now kind of use pills. That's why I have this here, this next visualization aid I use here, because they just try to use medication or different things on the student, which that's not the best thing for our kid. That's not the best thing for the student. Something that we should consider using going forward is going to be something like really talking to them and really letting them convey and speak out their emotions and how they're feeling. And that's why a big contributor to that is going to be another resource I use, which is the NASP, which is another association who tries to bring those trained professionals into the schools, so maybe don't have the funding for it. They like to do a lot of fundraisers and fundraising, and they bring that in. And studies show that many schools who get those trained professionals versus other ones who don't have significant results on the students' mental health and also how the students perform when it comes to doing their work, etc. Also, the CDC, great resource as well, has showed how community resources and bringing together the community and upping those community resources actually has a huge impact on how the students function and operate within the classroom. Because yeah, like I said, it is a big thing within the school and having those trained professionals, but also just bringing the community, having more things for the students to use as outlets for themselves is going to really allow the students and the whole school as its entirety to really grow and become a lot better. That brings us on to our next topic, really just showing the expansion and how we can really, have a positive outlook on, the mental health services within the school. So with that topic here, I'm gonna have our next prop here, which is a stuffed animal, which kind of shows the comfort that students can gain within the classroom in the school with these positive changes that we can hopefully bring about. So a first thing that's super important is going to be the improved academics. I think many studies show a huge study by the Mental Health Association has showed that many schools where they have students who can relieve themselves of their mental stress and their mental anxieties perform exceptionally when it comes to their academics. They're not just at home and in their own thoughts, but they're talking out their thoughts, whether it's at school or within the community, and then they're showing that, and that shows within their academics as their grades go up. Many kids who don't always communicate the most are now communicating a lot more and conveying their feelings and conveying how they feel, and that shows in their academics, which is the most important thing, And you can't expect a kid to learn really well in an environment when they're, going through all this stress and different things. But if they have an outlet for that stress, then they can take all their time and all their energy and focus on those academics that they really need to study for. And I think this also brings about just a safer environment as a whole. When you think about it, you think about bullying and a lot of the cyberbullying that we go through nowadays. But if you're able to talk to somebody and talk that out, you can really get rid of a lot of those issues when you have someone to talk to about it. And a lot of those negative thoughts that come with many students. And it just makes the environment safer. Everybody's a lot more friendly, everybody's a lot more understanding. And I think that shows in the studies that, our environments in our schools are definitely going to be safer. And that's really what we're looking for. It's just a safe environment for the students and a safe environment for the kids, of course. And then that brings us into our final, our final thoughts here. Really just shows, you can look at the data here, it shows that, the expansion of the mental health services in the schools is so crucial on all levels. First off, just getting those trained professionals in there to help out with the students and everything is a given, because like I said, teachers and all of them, they cannot take that burden. As well as just building the community better. That's really where it's going to start is, you can get all the trained professionals you want in there, but making the community safer and making it a better environment as a whole is definitely going to make the school as itself just a lot better for everybody. Going to make it better for the students, and then the students will reflect back to the teachers, as the teachers will reflect back to the students with all of that energy coming back and forth and make it a much positive environment. And I think this shows that we do put a lot of funding and a lot of money into our schools and the academics, the different sports aspects and extracurriculars that we have, but we also should definitely put a lot of our funding and a lot of our time really into the mental health and really understanding our students and seeing why they're going through what they're going through, and not just prescribing them with different pills and medications, but really understand and have them talk about what they're going through and what help they need and how we can help them get there. And I think that is a huge thing that we need to take seriously, and that's why the expansion of those services within the school system is going to be huge if we can come together and handle that. Thank you.